Hi, everyone. My name is Christine Herman, and I chose to do my health campaign on Alzheimer's disease. So, like I said, the illness that I have chosen to focus on is Alzheimer's. My campaign revolves around social media. I have created an account called Alzheimer's Connections on several different platforms that displays useful information on the disease and also provides outlets so that people have the opportunity to connect with one another. The purpose of this campaign is to provide information and support for those affected by Alzheimer's disease. The goal of my campaign is to spread awareness and make sure people know that they're not alone in their struggles with this disease. So, what is Alzheimer's disease? Alzheimer's is a brain disorder that slowly destroys memory and thinking skills and eventually the ability to carry out the simplest tasks. Alzheimer's is the most common form of dementia, and most people's symptoms appear in their mid to late 60s. However, in rare cases, early onset Alzheimer's before 65 can begin as early as a person's 30s. No cure currently exists, but medications and management strategies may temporarily improve symptoms. So, some of these symptoms include memory loss, confusion, poor judgment, the inability to perform simple tasks, challenges in problem solving, and more. So, why Alzheimer's? Well, more than 6 million Americans of all ages have Alzheimer's. An estimated 6.5 million Americans aged 65 and older are living with Alzheimer's in 2022. 73% are age 75 or older, and about 1 in 9 age 65 and older, which is about 10.7%, has Alzheimer's. Honestly, my grandpa had Alzheimer's, and I know how hard it is to watch a family member go through such a heartbreaking disease. It was a tough time for my whole family, but especially for my grandpa and grandma. Because of my personal experience with this disease, I wanted to shed light on all of the important information about it and also create a space where people could go to receive support from those who understand what they are dealing with. So for my research and interviews, I chose to interview 2 people for this portion. One person who has a family member with Alzheimer's and one person who works with people with Alzheimer's. For both assignments, I interviewed 4 people, collected 5 pages of notes, and asked 5 to 10 questions, and it took about 15 to 30 minutes for each interview. My first interview was a phone interview with Jacob. He was 37, white and male, and he was an infection control nurse at a retirement community. My second phone interview was Carla. She's 53, female and white, and her mother was diagnosed with Alzheimer's. The most important interview question I asked was what communication skills are most important when treating or communicating with someone with Alzheimer's. The interviewees' responses were picking up on nonverbal cues, being able to communicate nonverbally, patient-provider relationships, patience, talking slowly and in a calm voice, very good bedside manner, and patient-centered care. My overall assessment, being able to hear about the importance of patient-provider relationships helped me learn so much about how to effectively communicate with people who struggle with Alzheimer's. I was also able to learn how much of a difference a positive relationship can make on a patient's overall health and well-being. Hearing personal narratives throughout this process, as well as sharing mine, was a huge part of my learning experience and inspired me immensely. I wanted our campaign to show pathos and touch people at an emotional level. Being able to connect with others and hear about their real life experiences with the disease helped me to better understand its importance and impact. Learning about these concepts helped me to grasp the importance of a health community. This is what sparked my idea for a campaign centered around information and support. I decided to conduct my campaign through social media after learning about entertainment education. I know how fast and easy information is to access and share through these outlets, and I wanted to be able to reach as many audiences as possible. The purpose of my campaign is to create a safe, educational, and non-judgmental space via social media that people can come to when they have questions about Alzheimer's or want to be able to communicate with others who are going through similar experiences. It's important that the platform only provides the factual information that people can trust, and my platform will also offer the link to a weekly support group that we host over Zoom that will be open to anyone who feels like they need extra support surrounding an experience with Alzheimer's. So some campaign details. My target audience is the general public. Alzheimer's is a very common disease, and there are millions of people around the world who have been diagnosed or know someone who has been. My campaign objective is to provide helpful information, spread awareness, and connect community members. The impact of this campaign will help spread awareness and factual information about Alzheimer's, as well as provide support and community to those affected by the disease. My campaign timeline is December 2022, plan, campaign, and brainstorm. In January 2023, gather this factual information to use for the campaign and meet with specialists and get volunteers on board. February 2023, create social media accounts on Instagram and Facebook. And then in March, start advertising and host the first Zoom through accounts and continue having volunteers spread the word through reposting, liking, etc., and advertise through June. And then June is when we can celebrate our success. My campaign budget is $1,200 for advertising on Instagram and Facebook, $3,000 for medical professionals or support group leaders pay for the weekly Zooms, and $2,000 for pay for a social media content creator. Our communication plan is that we will reach audience through social media ads, our accounts via Instagram and Facebook, and through our discussions over our weekly Zoom support groups. We will keep our audience informed through our regular posts, and we will spread awareness through our audience reposts. So the purpose of my campaign is to spread awareness, provide helpful information, and bring people together who are affected by Alzheimer's. Being ill or having a loved one who is ill can be a very stressful, confusing, and distressing time. So I want to make sure the purpose of my campaign is to help those people feel less alone, more informed, and overall supported. We predict that we will be very successful in creating a community of people who attend the Zooms and visit our social media pages because of its easy access and effective advertising. So to summarize, communication is vital throughout this health campaign and is one of the most important things when dealing with Alzheimer's or dealing with someone who has it. Personal narratives, patient-provider relationships, health narratives, and nonverbal communication are some terms from this course that are a huge part of properly dealing with Alzheimer's and patients that suffer from the disease. And then we just have my references and my appendix. And then to finish up my presentation, I just wanted to show an example of the Instagram. So here's a little bit of something what it would look like. So for example, we have information on the support group here. We also have a how do I help section. So that is various ways to help loved ones who have been diagnosed with Alzheimer's. We also have some commonly asked questions about Alzheimer's, such as what is Alzheimer's? What is thought to be the main cause? Who is most likely to get it? And then seeking professional care, some websites for senior living homes. And then we also included some personal health narratives from people that I have spoken to who have experiences with Alzheimer's. So that is my presentation, and thank you so much for listening to my health campaign.